Hi, I'm Dr. Eitzen, and today we're going to talk about treatment options when it comes to venous reflux in your legs. When most people think of treatment of vein problems, the first thing that pops in their head is vein stripping. We do not do vein stripping in the United States anymore. So let's get into treatment options that are not vein stripping. The first is conservative management. This can include weight loss, elevating your legs above your heart as you can, exercise, over-the-counter or prescribed pain medications. If you're having swelling in your legs, a water pill maybe will help with that. But the gold pillar of conservative treatment is graduated compression socks. The goal of compression is to help improve circulation while you wear them and support the structures of the veins to improve return of blood back to your heart. The goal of compression is to manage your symptoms. It is not a fix. It will not fix any underlying damaged veins. If these conservative treatments are not fixing all your problems or curing all your ills, there are some other treatments available which we'll talk about now. When it comes to actually treating the underlying veins, there are two main categories of treatment options: thermal treatment and non-thermal treatment. When it comes to thermal treatment, we have two main options: endovenous laser or radiofrequency ablation. In both options, a device is put into the vein through a small little nick in the skin. The area to be treated is numbed up so that you don't hate us when we treat you, and we actually use heat from inside the vein to cause that vessel to collapse down shut. Think of it kind of like a heat gun to shrink tubing or a hair dryer to shrink wrap. Once this is completed, everything is taken out of the legs, and now you have a vessel that no longer carries blood to the heart, and the healthy veins, which we have hundreds upon hundreds of them in the legs, then take the blood back to the heart. In the non-thermal treatment category, there's a treatment option called Venous Seal. Similar to the heat options, this is done from inside the vein through a little nick in the skin. But what separates Venous Seal from these thermal options is because we're not using heat, we do not have to put numbing medicine along the vein. Instead, an advanced medical adhesive is put inside the vein, almost like a very fancy super glue. And this adhesive then is used to collapse the vein shut to force the blood to redirect from the bad veins to your hundreds upon hundreds of healthy veins. This improves circulation back to the heart, reducing pressure in the leg, improving symptoms, and preventing issues from continuing to get worse. Another treatment option for very large varicose veins is a treatment called micro-phlebectomy. I know that's a fancy word, but really what it means is these varicose veins are drawn out on the skin and then numbed up below the skin. Then through small tiny nicks in the skin, this vein is removed very gently to get it out of the body. This treatment usually takes a few small nicks, but you're up and walking within minutes after treatment and is not vein stripping. For smaller veins, a treatment option is sclerotherapy. This is mostly done in little feeder veins, or what are called reticular veins, or cosmetic spider veins. A solution called a sclerosant is injected into the bad vein, and this medicine actually causes the vein to collapse shut. With this type of treatment, no incisions are needed, and there is little to no downtime after treatment. It is very effective and is very safe.